Welcome back. With the long weekend on top of turkey, many of us have COVID on the mind. Specifically, what effect family gatherings may have on community spread. So here to take some of our questions, two infectious diseases specialists, Dr. Susie Hota and Dr. Isaac Bogosh. Hello to the two of you, and happy long weekend to you. So, Dr. Hota, let me start with you. It being Thanksgiving Monday, so depending on how Canadians celebrated and with whom, can you tell me what is the range of potential outcomes we're looking at here when it comes to COVID spread?
Right. So I think the first thing to be aware of is that anything that comes out of this weekend won't be apparent for another week or two, probably after the weekend's over. And that's because of the incubation period of the virus. So best case scenario, people would have heeded the advice of public health and limited their contacts, and we would see things come down. Worst case scenario, we continue on exponential rise, as we had been seeing just prior to the long weekend starting.
And we're all familiar with that old adage, you hope for the best, but prepare for the worst. So if we assume the worst, how should we all change our behaviors, if at all, over the next coming days or even the coming week and a half?
Well, I think, you don't really know how people dealt with this weekend around you. So it really does come back down to that advice of limiting the number of close contacts that you have in the upcoming weeks. That is what we need to do because we're seeing such a rise in COVID cases across the country, but especially in those hot spots. So being aware of that and also looking out for if you develop symptoms that could be COVID-19, immediately self-isolating, get tested. If you hear that somebody that you spent the weekend with and had, say, a Thanksgiving dinner or a gathering with has come down with COVID-19, then again, self-isolating and getting yourself tested. These are important things. What we don't want to see happening is everybody going out and getting tested now because they regret decisions they may have made on the long weekend.
Right. Okay. So that's good advice not to overwhelm the system. Dr. Bogosh, while we're talking about spread of the disease, can you help explain? I feel like there have been competing studies over the last little while, and most recently we heard new information about how long this virus can stay on surfaces, and yet for a long time it seems like we've been told, okay, maybe the threat of the virus staying on surfaces is not as high as we thought it was. What's this all about?
Yeah, so certainly I think our understanding of how this virus is transmitted has changed a lot since March and April of this year. And fomite transmission, which means you touch an inanimate object, then you can touch your eyes, nose, or mouth and potentially infect yourself. The role of fomites in transmission is probably a lot less important than what was initially thought. Of course, we still have to adhere to strict hand hygiene. We still have to wipe off high contact surfaces. It's just not a very likely mode of transmitting this infection. There was a study that came out recently that looked at viable virus on different surfaces, and it showed that the virus was viable for about 4 weeks. And I think we have to remember that a study like this, while it's interesting, was done under ideal lab conditions, and it's probably not that applicable to real-world settings.
Okay, now one last question I want to give you each a chance to answer. Just the thing that you're most watching out for in the weeks ahead as far as COVID goes.
I think the numbers obviously is going to be a big one, and how does the system cope with what happens this time around? But I'm also thinking this is a bit of a trial run before Christmas. So how well did we message things? How well have we gotten out to the public to tell them that close contacts really need to be limited?
And Dr. Bogosh?
I'm with Susie on this one. I'm also looking at hospitalizations and just looking at how our acute care system is coping with a growing number of cases.
Dr. Hota, Dr. Bogosh, lots to watch for. Thank you so much.
Take care.
Thank you.